there are some facilities that are stretched as we speak. For example, the facilities in hospitals, private, especially private and public hospitals, that relates to intensive care. Those ones have been stretched to an extent. There are still some beds available, but for sure, those ones are stretched. It is because of that reason that in the next 2 weeks or so, we shall be opening another facility at Kenyatta University Referral and Training Hospital. We are opening a facility there for an extra increment of 500 beds with some 60 ICU beds in the next 2 weeks or so. It is just to cater for that in case. As for the other county facilities, most county facilities that I have visited, in fact, including last week, were fairly empty. Even those with intensive care units, they were actually empty. Most of the isolation facilities in county institutions are also fairly empty. So you will recall, that a while back I was talking about counties not sending people to Nairobi. Quite feasibly then, it is now possible that the reverse may actually be the truth. That some people, if Nairobi gets too overwhelmed before the counties, that it may be possible to do it the other way around. And I'm impressed, never mind the criticism that most counties have been getting regarding their preparedness. I am impressed with the spirit with which I am seeing counties, and I can tell you that the reports, for example, that were in yesterday's papers regarding the preparedness in most counties was actually erroneous. These are just reports, ad hoc reports that come to us at all times because we continue engaging. And sometimes, for example, in the case of Kwale, maybe you visit one hospital in Msambweni, and you see Msambweni has got 72, for instance, health isolation beds. But that's not all they have. They have some other isolation beds in Lunga Lunga and other places, because as we advise them, maybe it is not a very good idea to have all the isolation beds in one spot, because some of those areas are large counties, and the more spread they are, sometimes the better.